Hi everyone, welcome to Ask the Experts. I'm your host Brandon Breeze, and I have my good friend and guest Nanci Goldsmith with me today. She is a licensed health and life insurance agent, and we're going to be talking about a really big topic in today's world, also known as Medicare. So, we have millions of people approaching that age where they're starting to think about this. When should people start to think about Medicare?
That's a good question. So you want to start thinking about Medicare probably when you're around the age of 64 to 64 and a half, because you are eligible to go on Medicare when you turn 65. And so you want to start planning ahead, because you will want to enroll with Social Security to get your Medicare A and B. So about 64, 64 and a half, you can start applying, and that way you'll be ready to go, make your plan elections, and by the time you hit your birthday month when you're turning 65, you'll be all set up for your insurance.
Awesome. That's really good information. So you hear about different programs out there. Could you maybe give us a brief explanation of the Medicare Supplement Program versus the Medicare Advantage Plan?
Certainly. So yes, there are different options. Once you do have your Medicare Parts A and Medicare Part B, there are some different options for you. There are Medicare Supplement plans and there are Medicare Advantage plans. Now, a Medicare Supplement plan, they both are offered through private insurance carriers. A supplement plan, and it truly does supplement what Medicare does not cover. So Medicare pays their portion first, then your supplement plan will come in and cover the rest of it. There are different plans. You might have heard of Plan F, G, and there's all different letters of the alphabet. They do cover different amounts, so that's a choice that you'll have. But again, the supplements, you pay a premium up front, and then on the back end, it will pick up those things that Medicare doesn't cover. An Advantage plan basically is like an all-inclusive plan, again, offered by a private insurance carrier. It takes your Medicare Part A and your Medicare Part B, gives you all of those benefits into one nice all-inclusive plan, plus it adds the Part D, which is your prescription drug plan. So it gives you the D, and then it adds on lots of extra benefits such as your silver sneakers, your vision, your hearing, all sorts of extra little perks, and starting at a $0 monthly premium. So there's some differences between the supplements and Advantage plans, and that's what I help people try to figure out what meets their needs and what meets their budget best.
Awesome. That's really good stuff. And so what about those people that are currently actively on their current employer's health plan? What kind of options would be for those people, or what should they be thinking about?
Okay, good question. So yeah, people nowadays are working past the age of 65. Mm-hmm. So if you're still working past 65 and you're on an employer plan, that's perfectly okay. You can stay with that employer plan as long as you're employed. Once you are thinking about retiring, again, you want to start planning ahead before that date, because you will then want to elect for your Medicare Part B. So you'll have to enroll for that through Social Security, and then you'll kind of go through that same plan that you would have done if you had elected Medicare at 65. You'll sit down with somebody and decide if you want to add on a supplement or an Advantage plan. You will have a couple-month window to elect that plan. And sometimes I have to tell people that even though they're on an employer plan, it's still good to look at the Medicare options versus your employer plan and see what comes out better, because you might be on an employer plan with a very high deductible and still paying quite a bit out of your check, and it might be more affordable and better for you to go right on to Medicare. So I help people look at those different options.
Awesome. Well, everyone I know likes transparency when it comes to a topic like this. So talking about affordability, does Medicare cover all costs, or I'm sure that question comes up.
That is a great question, because it's one of the misconceptions with Medicare is no, Medicare does not pay for everything. It doesn't pay for dental. It doesn't pay for the prescription drugs. It doesn't pay for vision and hearing. So there are things that it doesn't cover. Plus, when it doesn't even cover all of your Part B expenses. It only picks up 80%, and then the patient's responsible for 20%. So that's where these other supplements or Advantage plans come into play.
Awesome. Really good information. And I'm sure there's some other misconceptions out there. I mean, it's a very big topic. What are maybe some other important maybe misconceptions that you could maybe discuss on the Medicare topic.
Well, I think another big misconception is that people think Medicare is free. That doesn't cost, which would be great. Which would be great. Medicare Part A typically is because you have paid into the Medicare Part A by working all these years. You know, comes out of our paychecks, right? So Medicare A is, in a sense, now free. But Medicare Part B does have a monthly premium. Everybody pays Medicare Part B premium unless you're fully qualified for Medicaid, and then it would pick up your B. So there is a cost for Medicare. So that's one of the big misconceptions, and people need to be aware of that.
Awesome. Well, that's really, really good information. So that's going to kind of do it for our show today. If you have questions for Nanci, our expert today on Medicaid, all of her information will be at the end of this video. You can contact her directly. And we're really excited to have you here today. It was a pleasure. And we look forward to talking again soon.
Wonderful.
All right, take care.